We'll look at another method in which we can be able to use and solve issues of shoulder dislocation. Now, this is what is known as a Hippocratic method. Hippocratic method for treatment of shoulder dislocation. Okay, so anytime you hear Hippocrates in medical terminology, just how to do that is like the crook way. That's like the first ways that were used. So you keep the patient here and you try to reset the shoulder. Can I see it? Okay. Try to reset the shoulder. So after you reset it, then you now bandage it up. So let's go on to what the Hippocratic way is. So this method for treating shoulder dislocation is actually one of the oldest, just like I told you guys. Anytime you hear Hippocrates in medicine, it's the oldest thing. Okay. So it's actually what the oldest reduction technique is performed with the patient lying facing up, that supine, while the physician applies traction to the arm and counter traction using their heel in the axilla. Your hand in the axilla, you pull it down while you push it up with your leg. It will reset the shoulder that was fractured. Can you see? Okay, our orthopedic surgeon actually told us that when you want to do this, the patient should lie on the floor. Yeah, somebody could be there helping you too. So it's effective for anterior dislocations, but carries risks of, if you don't do it very well, the nerves around that place will get injured, or blood vessels around that place will get injured. So step by step overview is the patient is lying down, that's their face up. So physician setup, you hold the patient affected arm by the forearm and the hand. Okay? Hold it here or hold it here. You drag it down while you push it up with your leg. So place your heel, that's your leg, in the patient armpit. Okay? So traction, you gently continuously pull the arm along its axis. Counter traction is provided by the heel. You are pulling the hand down, but the heel is keeping the shoulder stable so that the shoulder doesn't pull down. You understand? So now manipulation, the arm is gradually abducted 30 degrees, externally rotated and internally rotated, flexed and extended while traction is maintained. This helps to release soft tissue contractions. So when the humeral head slips back into the glenoid socket, you hear a sound, snap, pop, any snapping sensation. Okay. So clinical outcomes is it's always successful. Okay, and at least you stay in the hospital for like 3 days, and functional improvement, constant Mole score improves significantly after the reduction. Okay, so well, you have to do it well because the only risk there is you don't want to injure the blood vessels there, you don't want to injure the nerves there.